Hi viewers, welcome to our channel. Presently, we are along with Dr. Karthik Paanduranga, cardiologist, Apollo Hospital. Hi sir, how are you?
Hello.
Sir, first of all, thank you so much for your valuable information to all of the audience. Sir, my first question is, what are the warning signs and symptoms of heart attack?
So, heart attack, as we all know, the blood supply to the heart gets reduced or stops. So, when any blood supply to any part of the body reduces, it will have a counter reaction or a counter response. This counter response comes as a pain. It's like a warning sign for the patient. So, majority of the patients will present with pain. Now, when I say patients, we should remember that patients can be divided into diabetic patients or non-diabetic patients. So, diabetic patients, that we'll deal with it little bit later, but non-diabetic patients, if they come, usually what happens, they present with commonest symptom. What they present is with chest pain, and chest pain usually will be central or left-sided chest pain. And how it will be like a constricting pain, like something is getting squeezed inside, or somebody, if somebody has put a belt very tight, that will be the kind of pain person will suffer. And moreover, along with pain, the pain might sometimes travel and also can involve the arm of the patient, usually the left arm, wherein the patient will feel that the same pain is arising here in the left chest and it is going towards the left arm. So this is the commonest presentation. Along with pain, patient can also have sweating, excessive sweating, profuse sweating, so much so that even the innerwear such as banyan or even shirt can get completely wet. Along with sweating, patient can have giddiness. These are all rare symptoms, but they are possible. Like for example, giddiness, patient can have giddiness, or patient can have breathing difficulty. Now, patient, if they walk a little distance, like few steps, they can have pain, and along with pain, they will have breathing difficulty. So these are the symptoms which are usually seen with non-diabetic patients. Whereas diabetic patients, they are a special group. Why I say they are special group? Because long-standing diabetes, that is patients who have got diabetes for more than 5 or 10 years, usually what happens, the diabetes will slowly destroy the nerve supply to the heart, and these things poses a very bad thing for the heart. Why? Because even if there is a blood supply reduction for the heart, still the pain will not arise. That counter response of the body or the heart is not seen, and the patient will not feel pain. That's why when a diabetic person comes to our OPD, we have seen that some of the patients will have already suffered an heart attack somewhere in the past, and if we ask the patient, they will always deny that patient had any chest pain. Such patients, we call that patient would have had a silent attack. So this is where the silent attack comes, where the patient can just have some mild acidity like features or breathing difficulty, and such patients will not have any chest pain. And such patients are very dangerous, because sometimes even at night while sleeping or while early morning during the sleep, patient can suddenly have an attack and patient might die also without any symptom. If there is a patient who has got non-diabetic, patient might have some pain and might get up, but in diabetic it becomes quite difficult to diagnose. So we have to be quite careful. That's why anybody who gets diabetes should also assume that whenever he gets checked for diabetes, he should also get checked for heart also for any problem. So these are like common features, common symptoms. And one of the common things what we have seen is, especially among females and diabetic patients, they present with burning sensation in the stomach. Majority of them think that it is acidity or some gas formation. They will have some Eno or some tablets for the gas or acidity, and then they will feel okay, it will come down, and in that process they will not go to a doctor. So that is a very bad idea, especially patients who are over 40 years of age and who are diabetic. I suggest any kind of pain around the chest, please go to a doctor once. at least once get an ECG done. That is the minimum you can do, and that is for your safety.